All right, looks like we've got a quorum, so we'll go ahead and get started here. All right, so welcome everybody. We're happy that you're here. My name is Nicole Douglas, and I'm a product marketer here at AvaSure. And today we are here to talk to you about something that's very exciting. We have a new enhancement to AvaSure's intelligent virtual care platform that connects patients with caregivers from anywhere. And we are so excited to see this solution come to life. Just the other day, we heard a story about how a virtual nurse was caring for a patient who was nervous about an upcoming surgery. They knew that patient was alone and they were scared. So that nurse made sure to call into the patient's room just before their surgery to wish them good luck and give them the patience and the reassurance that they needed to be brave. And that's really what it's all about. That's what we're about here. It's those little human moments in virtual care that improve the experience for patients while making sure that the bedside staff has the support and the resources that they need. During this session, we're going to discuss some use cases for episodic virtual care. We will explore key features that help to improve the patient and provider experience, and we'll discuss how AvaSure can support your hospital's journey to virtual care. This session will be recorded. All attendees are automatically on mute, but there will be some time for Q&A at the end of the session. So if you do have questions throughout the discussion, please go ahead and put them into the chat function into your GoToWebinar console. So if you know us already, welcome back. If you're new to AvaSure, let me introduce ourselves. At AvaSure, we're an intelligent virtual care platform that hospitals use to engage with patients, optimize staffing, and blend both remote and in-person treatment at scale. With AvaSure, you can deploy AI-powered virtual care solutions and make sure those solutions are deeply integrated within your hospital's ecosystem. We help our customers drive measurable outcomes with the support of our enterprise IT and clinical workflow experts. And we consider it an immense privilege that over 1,100 hospitals trust us to be their partner in virtual care. Next up, I'd like to introduce our speakers. So first, we've got Dana Pico. She is the Director of Clinical Solutions here at AvaSure with over 15 years of experience as a bedside nurse, and she spent the past 12 years designing solutions that drive better patient outcomes and an improved experience in healthcare. And next, we have Jacob Hansen. He is the Chief Product Officer here at AvaSure with over 15 years of experience building technology solutions that solve key challenges in healthcare while meeting those unique needs of hospitals, patients, and clinical staff. All right, team, you ready to talk episodic?
Let's do it.
All right,
Thank
Jacob,
you,
over to you.
So let's be honest, Dana is far more interesting than I am, but I appreciate Nicole letting me come and chat a bit about AvaSure and about our virtual care platform. So glad to be here with all of you. We're going to start a bit by just getting reacquainted with AvaSure. For those of you who have interacted with or known AvaSure for a long time, you might think of us as a point solution that was heavily focused on sitting, but there's also been a lot of transformation happening with AvaSure across a variety of different parameters. And so just wanted to touch base on those because as an industry, obviously there's a lot of change happening as health systems are working toward utilizing alternative care delivery models and engaging virtual caregivers in process at the bedside. There are things that need to adapt in the way health systems are working with vendors, and it really needs to be more of a partnership. This slide really aims at the 4 ways we think about those changes. The first one is the platform, and we're going to get more deeper into this, but on the platform side, that means being clear about the way that we think about flexibility in the hardware part of the platform, in the way that we utilize data and capture analytics to the benefit of delivering virtual care. It includes the approach to authorization and access to artificial intelligence. Then you've also got the partnership side. So really from a commercial standpoint, that means that vendors in virtual care have to be easy to do business with. That means when you add rooftops or a health system expands unit by unit, that there needs to be simple, clear ways for us to partner so that as health systems seek to add additional use cases, to layer use cases on top of the platform, that obstacles to doing so are removed. Then you've got the methodology side. I think a lot of people will know us as a company deeply committed to clinical workflow. We are 15% clinicians in our business as an employee base. We're all super passionate about it, but we love the fact that that we have so many clinical people in our midst, and that means that we are very committed to the utilization and optimization of virtual care programs. And so we're very excited to have been transforming, not just on the technology side or commercial side, but also we've got a new adoption model that helps us work step by step with our customers on where do I start? If I'm implementing virtual care, where do I begin? What are the places that I can drive ROI to then build on and add new use cases, so on and so forth. And the last one is at the bottom right there is support. Obviously, support's critical, the ability to connect into devices, to upgrade devices, add new features, and 24/7, 365 support when there are questions or challenges that we're ready to help do that at scale. We can go ahead and jump to the next slide. So when you think about supporting that kind of clinical methodology, the adoption model that we've introduced, it really demands one platform that can change everything. A platform that can help caregivers operate at the top of their license, a platform that's been demonstrably reducing adverse events for almost 15 years, and a platform that ultimately can deliver joy as much as possible back to nursing at the bedside as well. So this platform is critical. I want to emphasize a few things about what we've been changing in our platform, acknowledging the things that virtual care platforms have to deliver before we get to the most important part of today's webinar that Nicole already mentioned, which is the new application that we're going to be chatting about. Let's go ahead and jump to the next slide. So the AvaSure Intelligent Virtual Care Platform, as with everything else that we do, starts with the patient being at the center. That will never change for us. Helping caregivers take care of patients and keep people safe is at the heart of everything we do. You also see that we've got caregivers in various settings pictured here, whether they're at the bedside, in a command center, on a desktop machine, on the go with a mobile device. We know that a real virtual care platform has to be prepared to interact with caregivers regardless of the circumstance or the scenario that they're in. So let's dive into a few of the items just in the middle here about what we've been changing in preparation for helping a health system go from having deployed a single virtual care solution, say virtual sitting in a couple of units, to deploying virtual care in multiple units in multiple buildings across a health system. The first one's all about infrastructure. Up there at the top right of that center circle, you see the word cloud. From the clinical perspective, that matters because we, as a healthcare technology partner, need to work well with your IT colleagues in supporting whatever approach to infrastructure they're taking. So whether it's us deploying on-premise or in a health systems cloud or in our own cloud that we host, we now have the flexibility to do all of those things. You can see the word integrated, as I'm sure all of you would imagine, or are probably thinking about. Any new technology that's going to help with virtual care has to fold into the ecosystem of the patient room and of the unit. So for us, that looks like the most common flavors of integration being integration with EMR, integration with nurse call, with mobile handsets, with interactive patient care vendors that are managing what's happening on the TV. Then you've got these interesting words, media middleware. So for us, that means the introduction of a new standard API. Historically, we've been a closed system that aimed at really protecting a specific set of outcomes because they were relatively new and tied into protecting against adverse events. However, we've clearly heard what our customers have said and seen the transition or trend toward the need to support many use cases on top of a single platform. just purely for cost reasons, to rationalize cost for IT organizations and health systems. So this media middleware will allow third parties, non-AvaSure applications and algorithms to tap into our platform, more specifically the device part of our platform, to consume outbound audio and video, send inbound audio and video back into the room, and then even to control pan, tilt, and zoom on the camera, basically utilize that device as if it was their own, so that whatever you're using from AvaSure in terms of applications can be there, but then other tools could be virtual ICU, could be some other form of artificial intelligence, can all work on top of the same platform. A really important change for us at AvaSure, and an important step forward in the way that we think about platforms. You can see the word or the term artificial intelligence there. Last year, we introduced our computer vision for prevention and detection. Sorry, said that backwards. Detection and prevention of falls and elopement. That's all about augmenting observers or virtual safety attendants to make sure that they're being made aware of things happening as they're sitting and looking at that screen of however many patients they're observing, that they're aware of any risky things that are happening in that patient room. On the analytics front, we're super excited about a big change. We have all that same data from across our 1,100 customers, but now we're surfacing that using a Power BI front end. So nurse leadership or program leadership can slice and dice and drill into that data in whatever way they need to in order to optimize their programs. And then the last one is, you can see the device flexibility in this picture. Probably many of you know us for the carts that we've made for a long time, but we also now have a wall-mounted solution and a ceiling mounted or ceiling tile option for hardware to support. Really, it comes down to whatever workflow you need, the type of unit, the workflow happening in that unit that will drive the type of device that's needed. On the outsides, this platform needs to be able to support, you can see the continuous monitoring use cases on the right. Some of those are things we've been doing for a long time, and then it also needs to be able to support the episodic or more consultative interactions between caregivers and patients as well. And that is really one of the core reasons that we're here, that we're so excited about this new episodic application that we're launching. Why don't we jump to the next slide? So AvaSure Episodic is our new application to support virtual sessions for ADT, admit discharge, for specialty consults, whether it's wound ostomy or respiratory therapy or traditional like virtual rounding, that we can support all of those things. I am super excited to be here with Dana Pico. As I said at the beginning, she is far more interesting and talented than I am, so glad she's here. And we're going to get her queued up to demonstrate how this new application works. And we're excited to engage with our customers as we talk more about this new solution. In the meantime, while she's getting set up, I think we actually have a quick poll question. So take a quick moment. What is your organization's primary use case for episodic inpatient virtual care? If you will go ahead and respond to that briefly while we're waiting for Dana to get set up, that would be great. Always a hotly contested question, since there are many different needs relative to episodic outcomes. So, boy, we've got a strong winner in the clubhouse here on admit discharge, but a couple others pushing up a little bit. All right, Dana, if you're ready.
I am ready.
Okay,
We just
I'm going to
give
turn
the
it over to
another
you.
second. Perfect. Well, it bodes well for what we're going to demonstrate today. So I'm going to go ahead and share my screen. I'm going to end the poll so I can share my screen. So I hope everybody put in their results. And let me go ahead and share my screen for what you've come here to see. So let's go ahead and show you the episodic solution. You will get the pleasure of seeing me when my patient sees me. So I just want to walk you through the solution and how you as a care providers can leverage it and use it within your organization. What you probably are not aware of is that it is a web link, which is really nice. So you don't have to install anything on any devices. You can simply embed that web link on your intranet, and it's AD authenticated for people to access it. So if I'm a virtual care provider, whether it's a nurse, a case manager, I just go to the intranet, I tap that URL link, and I put in my credentials, and away I go. The other piece that I think is really exciting for all of you Epic shops out there, we do Epic context-aware linking. So instead of having to use a URL link, you can go ahead and launch the device in the room directly through your Epic instance. So imagine if you would, you have your patient's chart up, you're going to do your virtual encounter, whether you're a physician or a virtual nurse. There's going to be a little tab that says launch device or launch AvaSure. Your Epic team will design that and make sure that they name it something that's appropriate. And you simply tap that, thereby you don't have to leave Epic to go ahead and launch that device in that patient room. But for this demonstration purposes, we're going to do it the old-fashioned way and the URL way that most of us would access it anyways. So I just go ahead and I log in, again, AD authenticated, and it's going to bring me into my home screen. Like Jacob mentioned, we're no longer just a cart organization. We do have 3 different form factors. So as you notice on the left, this is the naming convention of your devices. So when you move to the environment that you're putting a device in most or all rooms, we would have you name it appropriately based on that room location. Again, it could be a ceiling mounted device or a wall mounted device, and then leverage that patient TV for that 2-way encounter. And you can still have the devices listed if you're starting with the mobile devices. They will be listed here too. We just want to make sure that that person is aware of which device has been pulled into that patient room. We also give you context about what's happening with those devices. So as you see here in this middle column, the device status, we have 4 statuses available. Obviously, what you see here, available and unavailable, are pretty self-explanatory. Available, I can launch that device. Unavailable means that maybe it's a mobile device and it's not in the room and it's not plugged in, so it's not available. But the other 2 statuses that are important to point out would be monitoring in progress, which is a visual indication to me, the virtual care provider, that that patient is currently being monitored by a virtual safety attendant. I can still access that device. You don't have to add a secondary device. You don't have to move anything else into the room. I can go ahead and do my virtual encounter with that patient. The nice thing is we provide almost like a virtual handoff or a handshake to that virtual safety attendant. What will happen on their end is when I start my call, they will get a pop-up in that patient's room that states that Dana Pico is going to be accessing this device. So that way there's no concern about somebody's taking over that device and they are unaware of it. So we do that virtual handoff or handshake. And then the last device status is call in progress. What that means is maybe a physician is doing a consult at the time and they're actively using that device. We don't want to interrupt that encounter with that physician or with who's ever doing that virtual encounter with that patient. So we make it very clear to you that that device is currently being used and there is a call in progress. And what you'll see is the grayed out component over here on the right. But we have a device available. You guys want to see how it works, how simple it is. And so I'm going to go ahead and start the call with my patient in room 412. It's going to ask me to validate that, of course. And when I go ahead and launch that call, you're going to hear a doorbell in just a second. Hello, Miss Quiring. Can I come in and do your discharge teaching?
Okay, yeah, come on in.
All right. So I'm going to go ahead and launch my camera. And there's my patient. Good afternoon. You're looking well. You're going home. So super simple to launch, as you see. A couple things I want to point out on this screen is you can still use your mouse to pan, tilt, zoom if you want to. If you don't like using a mouse, I can go ahead and use the buttons on the left. I can zoom in and out using the buttons on the left. So we make it easy for end users to either use a mouse or use the buttons, whatever they're most comfortable with. You still, those of you who are AvaSure users today, you still have the ability to launch a stat alarm. So if my patient here, Sarah, is starting to look a little peaked, maybe she's getting diaphoretic, short of breath, I need a bedside caregiver in the room immediately, I can still activate that stat alarm to get the bedside staff members into the room quickly and efficiently. A couple things about these bottom buttons. I can go ahead and turn my camera off if I need to. So if somebody comes into my command center or something's happening behind me and I think it's distracting to the patient, I can turn my camera off. I can also turn my microphone off. So think about those weekends and holidays when you have a single case manager on, you have a bunch of discharges, they don't have time to leave their office because they're afraid they're going to miss phone calls. So what they can do is they can have their virtual encounter with the patient, and they can still stay in their office. If their phone rings, they can mute the call with the patient, take their call, and tell the patient, good news, insurance came through, you're going home. Whatever the case may be, they still stay connected. Lastly, before I invite some folks to join our call, is our settings tab. So you can go ahead and pick and identify how you're launching this call or how you're interacting. We do have, obviously, if you have a webcam instead of using your computer cam, maybe your webcam's a little better, you can pick that. If you're using a headset, whatever the case may be, you control your settings. What I think is the most exciting is we get to invite people to our call. So just to give you context and how nice and clean and how streamlined this is, I'm in Florida, Sarah's in Michigan. I'm going to invite her husband, Mauricio, who's in Texas, and her nurse navigator, who's also in Michigan. But you see there's no lag in this conversation, no lag in the communication. So it makes it really nice no matter where you are. I'm going to go ahead and add some guests. Couple things I want to point out. I can add up to 4 additional guests to my call. I'm going to invite Mauricio, her husband, and he's going to join the call along with her nurse navigator. And as you notice, I can do it either via an email or I can do an SMS message. Either one will suffice. Let me do that. And I can, as you can see, I could put both recipients in simultaneously and ask them to join my call. What's nice is when I send these out, the recipients do not have to install a single thing on their device. They can join from a phone, they can join from a tablet, they can join from a computer, whatever's easiest for them. So if you're thinking about Sarah's husband being out of town or at work, I want to go ahead and add them into the call. As I said, you can have as many as 4 different people joining the call. So if you're doing multidisciplinary rounds, and well, there's her nurse navigator, Olivia. Hi, Olivia. And then if you want to have multiple different folks joining the call, you can go ahead and do that. I am the keeper of the call. So one of the other components that I think is important to think about is oh, here comes her husband. Hi, Mauricio. Hello. I can control them as well. So if Mauricio, it looks like he's at someplace fun and maybe it's going to get a little loud, I can go ahead and mute him if I want to. I can also have people leave the call. When their presence is no longer needed, I can go ahead and have them leave the call. It's up to me as a controller of the call to allow people to speak. As you see, he muted himself because I think he knew it was a little loud, but thank you, Mauricio. But it really is nice because I can control the call and invite who I want into it. What I think is important also to point out is the link that they receive is only as good as the length of the call. So for instance, if Mauricio, I see he's somewhere and he loses Wi-Fi connectivity and he drops, he wants to rejoin, he certainly can, as long as I have not had him exit the call or I didn't exit him from the call. So he can certainly join back in if his Wi-Fi connectivity is no longer good or if he drops. I'm going to go ahead and show you how the experience is because we're done with Olivia. She said what she needed to say. She gave Sarah all of her marching orders for the future. So I'm going to go ahead and politely ask Olivia to leave, and I'm going to go ahead and remove her from our call. And all I do is just hit remove guest, and there you go. Olivia is gone. Again, I control it. Olivia cannot rejoin with that link. Same thing is true with Mauricio. When this call is ended, maybe he wants to say goodnight to his wife Sarah at 10 p.m. He cannot access those devices. Whoever launched the call can go ahead and control the call, which I think is really nice. So you don't have to worry about people or family members accessing those devices unbeknownst to you. I hope you see how easy it is. It's super simple. I think the key takeaways are, if you're Epic, we can go ahead and embed it into your Epic solution and do context-aware linking. It's super easy to navigate. You can add as many as 4 people to the conversation. And I think lastly, Jacob alluded to it, multiple times I've gone on site to talk to some potential virtual care hospitals that are looking to a virtual care platform, and they don't know where to start. They're just kind of struggling with, what are we going to do? How are we going to start this? What policies and procedures are we going to put in place? We have you covered. We have nurses that are going to come on site and help you and work with you and make sure that your program is stellar. We're going to help you with your policies and procedures. We're going to help you with your job descriptions, your workflows, everything you need to do to start your virtual care program so that it's easy for you. As easy as the technology, it's going to be just as easy for you to set it up. So with that, Mauricio, enjoy wherever you are. It looks really beautiful. And Sarah, I'm glad you're feeling better. You get to go home. Take care. Have a wonderful week. And thanks for participating. Bye, guys. And that's
Bye-bye.
it.
Thank you.
End the call. Any question? Oh, well, I should turn it back over to our team. I was going to say any questions, but we got some more to share. I think we're going to go back to Jacob for a couple more little tidbits and then open it up to questions. I hope that was easy to follow, and I hope you're all as excited as we are. So go ahead, Jacob.
Thanks, Dana. That was awesome for me to watch. I'm sure everybody else was. There was probably like a standing ovation happening, people clapping and cheering. I have no doubt. So a few more things that just wanted to cover here, in terms of why this plays such an important role, why AvaSure Episodic is such an important step forward for us. The first is, as you saw there, group calling, the role that group calling can play with with supporting various use cases on an episodic in an episodic standpoint. The second is integration. So you heard Dana talk about Epic Cal integration, so that ability to launch directly from the patient record. But we have lots of other forms of integration, and the one I just want to re-emphasize that I talked about earlier is that standard API, the ability for not just AvaSure applications to take advantage of the platform, but for third-party applications and AI to do the same, which is really point 3, to consolidate virtual care use cases all on a single platform, one platform that can change everything from a supporting alternative care delivery model standpoint. And then the last point is that we take a lot of pride and put a lot of focus in what it means to support our partners and customers in utilizing, deploying, and optimizing the programs that we put in place to support virtual care. And we're super excited to do that with this new application, alongside all the fun that we have with applications that we've been deploying in the past with Telesitter and Verify. So looking forward to doing more of that. I think it's time for Nicole to join back here, and we're going to talk some Q&A, if I'm not mistaken.
That's right. Thank you both. Before we transition to Q&A, we want to make sure that you all have the save the date for our upcoming annual customer symposium. It will be October 2nd through the 4th in Grand Rapids, Michigan. And for these symposiums, we're always so excited to see our customers in person. We're going to have excellent networking events, discuss the latest news in virtual care, and make sure we have a forum to share best practices to make your programs a success. So mark your calendars and be on the lookout for more information from AvaSure in the coming weeks.
Nicole,
Right.
can I just cheat and jump in and say,
Sure.
don't miss that event last year. It was one of the highlights of my whole year to rub shoulders with all these people deploying and utilizing virtual care tools and solutions and sharing ideas. It was a blast. It was so much fun to hear all the great catches. Can't emphasize enough what an amazing chance it was to connect with our customers. So don't miss that one. We're hoping we'll hope you'll be there with us.
Absolutely. All right, on to our Q&A session. So we did have several questions come in, so thank you for everyone for sending them in. If you haven't, there's still time. If we don't have a chance to get to your question here, we'll make sure that we follow up with you directly after the webinar. So our first question here, Dana, this one will be for you. My hospital is looking for ways to bring specialists to patients. Can episodic be used by caregivers other than nursing?
Absolutely. I think I kind of alluded to that during the presentation or the demonstration. We don't want you just to isolate it just to nursing. We want it to be your virtual care platform. So we welcome the use cases for physicians. I know a lot of organizations have multiple tools at their disposal for physician usage, but please, once you have this all deployed, you can certainly leverage it for those virtual consults for physicians, case managers. Clergy is a big one that's been coming up a lot, that a lot of organizations are looking to have clergy join. So this is not just a nursing tool, it's an all-encompassing tool for your entire ecosystem.
Excellent, thank you. Next question I had here, Jacob, this one will go to you. Can you speak to the most common video integrations you're seeing in hospitals today, and where do you see the need for those to live?
Yeah, good question. I think there's definitely a lot of focus on the importance of two-way video. You can see the importance of that with what we just saw with Dana in the demo here. I would say the most common that we see, there's really two forms. The first one's not so much an integration as a physical connection, which is we have the two of our devices in our hardware platform, the ceiling and wall mounted devices that can connect via a high definition cable back to the TV, and that uses CEC controls to turn the TV on and off, change the input to and from the right thing for that episodic consult. And then the second one is with interactive patient console or interactive patient care vendors directly who are focused on like patient engagement using the screen in the room. And so we're seeing more and more with that, and are working on integrations with several of those. So.
Excellent. Thank you. All right, next question, Dana, this one will be for you. For episodic care, how do cameras get deployed to the patient's location?
So there's a couple different ways. Obviously, if there's an installed device, we'll just actively use that device that's in the room. But for those mobile devices, what a lot of the organizations are doing is just like you're setting up your room for an admission or a discharge, you'd go ahead and roll that device directly into the room. While we're here too, I think it's important when we're talking about devices, there was a couple questions about the night capabilities of these devices. Since you already have night vision available on these devices, I saw somebody had a question about that. You still have all the same components from the hardware perspective that you do, whether you're using Telesitter or virtual the Verify client. You still have the pan, tilt, zoom, and the night vision. So you shouldn't have to worry about that if the patient's room is dark and you want to do some virtual rounding. I think when we're talking about hardware, it's nice to point out that you still have all the same components. And from a workflow perspective, if it's a mobile device, when you're setting up the room, you just roll that in, leave that plugged in, and that way that virtual nurse can access that, whether it's a discharge or admission.
Gotcha. Thank you. All right, next up, Jacob, this one's for you. Does the platform support a virtual background for things like branded backgrounds?
Good question. So that is something that we are definitely planning to include. The very first release of AvaSure Episodic, we don't have an ability to blur a background or to use a branded background, but we will be. We're planning to add that in second release, and we'll be targeting that in a matter of months, just down the road. potentially as early as like the end of Q3. And so we are actively working on that.
Great, thank you. All right, Dana, next one's for you. Does your platform support virtual precepting or mentoring, and what does that look like?
Sure. So we have two different applications that you can use. We have obviously this episodic solution that you just saw, so that if I have a newer nurse and they maybe want some support during maybe putting in setting up a plurivac for the first time or doing some kind of task that they're not comfortable with, you can certainly leverage this solution to do that. The other component is we do have a verified client where it's a more of a one-to-many. So you'd be able to, if you have like a preceptorship floor or you have multiple rooms that have newer nurses and you want that expert oversight to be mentoring them, they can bring in as many as 38 rooms into their view. So that way they can kind of go around and check in with those rooms, check in with those nurses. It makes it really easy for them to use either solution to meet the needs from a preceptor perspective. And I think what's important to think about too is it's all inclusive for the solution. So you not only get the telesitter client, the episodic client, but you also get the verify. So you can really meet all of your workflow needs, whether it's virtual safety attendant needs or safety sitting needs or virtual care needs, you get it all with one solution.
Thanks, Dana. Kind of piggybacking off of that, just talking about the one solution. So if a customer already has devices, for example, can they be used with other solutions, and how do we kind of manage that arbitrage between them?
I'll let Jacob take that one.
Yeah, so if you have AvaSure devices now and you want to add third-party applications running on top of our platform, the arbitration of the uses, we hear a lot of organizations talking about wanting to layer use cases on top of each other, but rarely are people thinking about how to manage access. It's no different than if a caregiver's in the room, if one caregiver's in the room talking to the patient and another one wanted to barge in and start talking right away over top of somebody else. You've got to have some sense or awareness of what applications are engaged and what virtual caregivers are participating. So our platform will arbitrate, will keep track of if somebody's wanting to connect, making sure it's clear, hey, this person's being monitored for falls in a continuous setting. This patient's also got an active episodic call going. And when one of them is active, for example, a sitter can still see the patient, but they'll have some indicators that make it clear to them that somebody else has engaged the patient and is involved in that room. And then they'll also be notified when they drop off and discontinue that interaction. So I hope that answers the question, Nicole.
Yeah, thank you.
Yeah, you bet.
All right, Dana, I'll bounce this back to you. So how long can people keep accessing that link once they have it, and how many people can be invited into the episodic call?
Sure. So the link is only good for the duration of the call. So if I went ahead and sent that link out and my call lasts 60 minutes, it's good for that 60 minutes. As soon as that call ends, that link is no longer accessible. And number two, from how many additional folks can I invite? I can invite up to 4 additional people to the call if I want. So it would be me, the patient, and then 4 additional people.
Okay, thank you.
Hey, Nicole, can I answer one of these questions that I think is really great in the chat?
Yeah, of course.
So it comes from Monica Liu. I'm so excited you asked this question. You're asking about what other use case or scenarios can you use the AvaSure solution in? And I like where you're thinking. A big use case has been coming up recently about using our devices in the OR. So for instance, like Jacob mentioned, we have ceiling mounted devices. Imagine if you have a really busy OR, 20, 25 rooms, and you have a single board runner. There's lots of coordination of care going on. So how beautiful and brilliant would it be to have these devices in the ceiling in your OR so that board runner can use the verified client and look at every single room, what's going on, talk into the room, see what's going on with them. That way they can kind of manage the flow of the OR without having to walk back and forth or use the nurse call solution. They can physically see what's happening so that they can plan accordingly with those patients waiting in pre-op or nurses waiting for the patient in PACU. It really gives them eyes in the OR to make sure that everybody is on the same page in situational awareness. So I like where your head is at, Monica. I think you're thinking outside the box, and I love that.
Thanks, Dana. I got another question for Jacob here. Do you have to be on AvaSure's cloud to utilize the web client, or can you use it with on-prem deployments?
So that's probably a multifaceted answer to that question. So with this first release, the AvaSure Episodic, that application is a cloud-hosted application that can be hosted by our customers, health system cloud relationship, or it can be hosted in AvaSure Cloud. It can also be deployed alongside Telesitter deployed on-prem. You don't have to move Telesitter to work with AvaSure Episodic. And then we will keep iterating on the variations of how the different applications can be deployed. But at the outset, Telesitter can stay. The platform itself could be deployed on-prem. Episodic is a cloud-based solution and can be hosted either customer or AvaSure hosted.
Great, thank you. I'm going to keep it with you, Jacob. Lots of questions around integration with Epic. So could you just run through our available integrations with Epic and where we're going with that?
Yeah, you got it. So we have 3 forms of Epic integration now, and we'll be adding a 4th here in just a very short period. The first one is inbound orders from Epic. It's an HL7 message, but if you're on the clinical side, that just means that we get some data about the patient, like reasons for monitoring. We get information about staff, and that comes into our system. That way, then we have outbound back to Epic in certain cases where customers want to have data sent directly back to the patient record. So things like how long a patient was monitored, and we're actually adding to that data that we send things like, were there interventions? Were they canned interventions, verbal interventions, stat alarms, things like that? A lot of the data that's also available in the AvaSure Analytics solution. And then the third one is the one Dana was talking about, which is called context-aware linking. So that is the ability to automatically launch AvaSure Episodic out of the Epic patient record. Press of a button and it introduces that. And then those 3 are all part of what we do today. We are adding a 4th version, which is called Epic eCal, embedded context-aware linking, which focuses on the ability for Epic Monitor to connect to the AvaSure platform as well. So lots of ways to integrate with Epic, and happy to chat more about that as well.
Thank you, Jacob.
Yeah.
All right, we're coming up on time here, so I'll ask probably the last question here. So if I'm currently a AvaSure customer, currently using Telesitter, how can I integrate this solution into my current program?
All right, I'll tackle that one too. So if you are using Telesitter, the how really just comes down to bringing your platform to the latest version of software. So wherever you're at, we would just upgrade software to the latest enterprise version of software. We would then also need to make sure devices on our latest firmware versions. And then once that's done, we would figure out where your preference is to deploy AvaSure Episodic in your own cloud or in our cloud. And then we can begin moving forward with actively using both applications on top of the same platform. In some cases, I would say it probably makes sense and this is probably more of a, Dana, if you want to jump in on this, like you could start with a targeted approach to where Episodic is being used, kind of the same way you would think about deploying and utilizing Telesitter and expanding. But Dana, you want to jump in on that?
Yeah. So I think that's part of the premise of our question is for your program to be successful, we don't want to boil the ocean in one swoop. So we want to think about those more strategic workflows that really are going to have an impact. So admission and discharge seems to be the #1 driver for a lot of organizations because they're having throughput challenges. So to Jacob's point, it's not only upgrading your technology, but it would be working with our team to make sure that we identify what workflows we want to track tackle, and then build out your metrics so that we can show that it's a successful program. So most organizations start with the admission discharge process. Obviously look at your throughput issues and make sure that we're developing a strategy to meet those needs, and then morph out to the mentoring or maybe into different type of consultative efforts. But really, to Jacob's point, it really does help when we kind of narrow the scope and make sure that we identify what you want to tackle first. And again, most often we're seeing admission and discharges to get started.
Great, thank you both. If you reach out to your AvaSure representative, your customer success advisor, we'd be more than happy to take a deep dive with you to see how we can continue to beef up your program. So that's all the time we have today. There are a few questions we did not have an opportunity to get to, so someone will be following up with you directly. Thank you so much for joining us today. We're very excited about the latest advancement to our platform, and we're really excited to build the future of virtual care with you. So AvaSure will be at AONL and ATA coming up. So if you're at those conferences, come by, say hello, and see what's new with us. Thank you again for joining us today. Have a great rest of your afternoon.
Thanks, Nicole.
Bye,
Appreciate
everyone.
it. Thanks, Dana.
Yes, thank you. Bye, guys.